Right now, we're going to talk with Dr. Howard Dorne about strokes, which are the third leading cause of death in this country. Dr. Dorne is an interventional radiologist at St. Joseph's Hospital in Orange. He's been named 2008 Physician of Excellence by the Orange County Medical Association. Howard, thanks so much for coming on Health Matters. Why don't you tell us a little bit about strokes and what they are and what the symptoms may be?
Well, Larry, as you mentioned, stroke is a major cause of death in the United States, third leading cause. It's also the major cause of disability, and stroke is manifest by a constellation of symptoms. The most common one that's associated with stroke is paralysis, lack of movement of an arm or a leg. Frequently, it's both the arm and the leg on one side or the other, because the left side of the brain controls the right side of the body and vice versa. People with strokes also can have difficulty with speech, difficulty with vision, balance, dizziness. So any kind of sudden onset of a neurologic abnormality is considered a stroke.
And if the symptoms go away within a few minutes or an hour, is that a stroke?
It's what people commonly refer to as a mini stroke, or a TIA, and it's still a very serious problem. Stroke we usually associate with a fixed deficit, something that lasts.
And how long does a patient have from the onset of a stroke to reverse the effects of that stroke?
This is a relatively new part of medicine. As recently as 10 years ago or so, when someone had a stroke, all we could do was support them, help them deal with this deficit. Now we can open up arteries and treat the stroke. We need to see them within 6 to 8 hours. And if they go to a center that isn't highly specialized in stroke, they need to be seen within 3 hours to get therapy.
And the initial therapy years ago was just a clot buster, right? And then, you've been doing that for many, many years. But
That's correct,
now it's evolved to more intensive things. And recently, I believe you took care of some patients who had a stroke that you actually could extract, and that's one of the catheters that you used here?
This is one of the devices that we're able to use to extract clot within arteries in the brain. This is called a Mercy Retrieval device, and what we do to use this device is thread a catheter into one of the blocked arteries in the brain and then put out this corkscrew-shaped wire, put it beyond the clot, and then pull back very gently and very slowly and try and pull the clot back into a catheter and then extract it to allow blood flow to go up to the brain.
Now, when you do that, you're giving some clot busters also, or you're just using the mechanical extraction of it?
We can do it both ways. Sometimes we put a catheter right on top of the clot and administer the clot busters. TPA, tissue plasminogen activator, is what we generally use. Or we can use the devices alone. There's the Mercy device. There's something called Penumbra, which is more of a sucking device. Anything that gets the clot out, we're happy with.
Yeah. And this is amazing technology because, as you said, we did nothing before other than to treat the paralysis afterwards and the rehabilitation. Now we can intervene, and we've had some common patients in common that you have done this on. We're going to show some of the video that you did actually on this patient extracting this clot. It's really an amazing thing to see.
Hi, I'm Howard Dorne. I'm one of the interventional radiologists at St. Joseph Hospital and Children's Hospital of Orange County. One of my areas of great interest is treatment of stroke, and that falls under the heading of neurointerventional radiology. Not so many years ago, when someone would have a stroke, very little could be done for them. Most of the care we provided was supportive, meaning that once someone had a stroke, let's help them get through the deficit. One of the most exciting things about my specialty currently is that we can actually treat stroke. And if patients come to the hospital and get here early, we can actually treat and reverse the effects of a stroke. Now, I have to emphasize it's extraordinarily important that if anyone has stroke-like symptoms, weakness in an arm or a leg, difficulty with balance, difficulty talking, they need to get to the hospital right away so that we can institute these therapies. One of the therapies I'd like to explain is how we actually go into the arteries in the brain and try to remove blood clots that are blocking blood flow to the brain and that are causing the stroke. This patient came to the hospital with a blockage in the main artery that goes up to the left side of her brain. There's no blood flow up to her brain. When we look at an injection on the opposite side, her right side, we can see the right side is helping fill the left side of the brain. So what we did was we negotiated a very tiny catheter into the area of blockage. We put a little X-ray dye in there, which shows us a big clot. We put a device, it looks like a corkscrew, a little corkscrew wire to suck out the clot, which we did, and now we can see great fill in that part of the brain. And here's the clot that we removed from a patient very similar to this one. And this patient, who had significant weakness on the right side of her body, showed complete resolution of that weakness. So she came in unable to speak, unable to move the right side of her body, and afterwards was able to speak quite well and was able to use her right arm and leg.
So, that's such an amazing video to see this patient who's will probably be totally paralyzed for the rest of their lives, affecting their family, affecting their whole life, and coming into a place and having you do that amazing technology.
It's one of the most gratifying things that I do.
Yeah, you take
We
a
can
person
see why.
Yeah, from a person who will not be actually a totally different life to a normal life. Now, not all strokes are due to clots, right? What do you do with other types of strokes?
Well, we usually divide strokes into two main categories. Ischemic, which means lack of blood flow, and that's where we're talking about clots, and hemorrhagic, or bleeding strokes. And those are of two basic types. One is generally associated with things like aneurysms, weak areas in the arteries of the brain, which we can also treat now with our little catheters. And that's usually shown by main symptom is a terrible, terrible headache, worst headache of someone's life, or bleeds into the substance of the brain, which are usually associated with hypertension.
So you don't want to take anybody who comes in with a stroke. You need to do some type of diagnostic test when they come in the emergency room. So if a patient comes to a hospital that's set up to do this whole process, a stroke treatment center that can do this invasive catheter removal of the clot, the process is what, briefly?
It's really very interesting. Patients will be acutely brought to us, hopefully just as soon as possible after the stroke, okay? Because we only have that short window to treat them. They'll be very quickly evaluated in the emergency room. They'll go for a very quick CAT scan, computed tomographic scan of the brain to look for evidence of a bleed, because that's a big decision point. Are we going down the hemorrhagic side? Are we going into the ischemic side? If it's an ischemic stroke...
Meaning a clot.
Exactly,
Yeah.
exactly, the clot side. If we have the clot side stroke, then we determine if it's a significant size stroke and if they're a candidate for these advanced therapies. And if so, then my team gets involved. We bring them to the cath lab, take pictures of their arteries, find the blockage, and go after it. We want to get that clot out.
And to have this team approach, you really have to have physicians like you available 24/7. I mean, somebody has to be on call who's skilled in this unique type of technology all the time.
Absolutely. That's why there are only a few comprehensive stroke centers out there.
Briefly, what do you tell the person who has these symptoms, they're home and they go away within an hour? They had paralysis on the left side and the symptoms resolve and they're feeling well.
That's still a medical emergency, because those transitory symptoms are warning signs, and they're warning signs that you might have a stroke. And the whole goal here is to prevent a stroke. So if you can get in before you have the stroke, if we can find out why you had these symptoms and treat that before you actually have the stroke, you're so much better off. So don't delay.
Yeah. And the basic causes of a stroke, the risk factors for a stroke are basically the same ones we have for the heart, right?
Exactly. What you see in cardiology, diabetes, smoking, unfortunately, hereditary things, age, bad foods, high cholesterol, all the things that you're used to, hypertension.
Yeah, all the risk factors, traditional risk factors for heart disease also contribute to stroke. Well, we only have a minute left. So really the message is this is a medical emergency and you should get to the place that treats you probably the best. And how many places are in Orange County that can do this type of treatment?
Aside from St. Joseph Hospital, there are perhaps another 3 who can do the very advanced stroke therapy.
So if somebody wants to be really prepared, they should see what hospital is in their area where they live that they may be brought to and plan ahead perhaps and find out what has they should ask for a stroke center or they should ask for a stroke center with an interventional radiologist. How would they find that out?
They'd be most interested in a comprehensive stroke center because that's their best shot at getting their stroke reversed.
Well, thank you so very much for joining us today. It was really interesting, and we so enjoyed that clip showing this wonderful work.
It was a pleasure. Thank you.
Thanks for coming on Health Matters. It's great.